Good evening, and thank you. Thank you so much for joining us for this very important seminar. My name is Becky Sobelman-Stern, and I'm the Chief Program Officer and Executive Vice President at the Jewish Federation of Greater Los Angeles. At the Federation, we protect our community and bring vital resources and information to help ensure a strong, healthy, and vibrant Jewish future. We accomplish this by building community in a way only we can, by working tirelessly with our cherished partners to identify and address our greatest issues facing our community. We at the Federation are here to support our community, those who have lost loved ones and those who may be sick or impacted by this pandemic. We are providing expanded resources to community members most in need by providing cash assistance to pay emergency bills, providing food for the hungry, providing in-home support to our Holocaust survivors and frail seniors, by providing interest-free loans to business owners, and by providing support to families needing financial aid. Our community call-in line is available as a constant resource for anyone who needs it. Please see the chat here for the number and additional information. We at the Federation do all of this with a sense of purpose and a responsibility based on Jewish values such as Tikkun Olam, our belief in trying to repair the world. We recognize we are in the midst today, and the news keeps telling us, we are in the midst of another alarming surge. And we deeply thank the frontline responders, doctors, and healthcare workers for their tireless efforts to take care of our fellow Los Angelinos. While we are facing these dark times together, we also recognize the hard work of scientists who have brought us hope and a belief that there is light at the end of the tunnel in the form of a vaccine. Today, we are joined by two very dear friends of the Federation who will lend their expertise regarding preventative measures and the latest information on the vaccine. Cedars-Sinai Chief Medical Officer, Dr. Richard V. Riggs, and Rabbi Dr. Jason Weiner, Senior Rabbi and Director, Spiritual Care Department, are generously sharing their time because of the strong connection Cedars-Sinai and the Jewish Federation have on an ongoing basis. We extend our thanks today and every day for this partnership. Let me tell you who you have here. They really are experts. As Senior Vice President of Medical Affairs and Chief Medical Officer, Dr. Riggs oversees the clinical quality, medical standards, efficiency, and effective use of clinical resources for high-quality patient care at Cedars-Sinai Medical Center and Cedars-Sinai Marina Del Rey Hospital. Rabbi Dr. Jason Weiner serves as the Senior Rabbi and Director of the Spiritual Care Department at Cedars-Sinai in Los Angeles, where he is responsible for the chaplaincy team and all aspects of spiritual care. Who better to talk to us than these two highly accomplished professionals? The road to full vaccination for every Los Angelino will take all of us, all 1,000 plus of us and more who are on this webinar. It will be a blend, a mix of understanding basic information and being responsible for one another. It's the art and the science that would help us reach the point where we can gather again, hug, and support each other in person. It's our aim that the information provided here today will help our beloved Jewish community, our beloved city, along the road to immunity. We will try to get as many of your questions answered as possible. And first, we will begin with some opening comments from Rabbi Dr. Jason Weiner and from Richard and Riggs, Dr. Riggs. So with that, Rabbi Weiner, I turn to you to give us a little perspective from the chair and seat that you sit in at Cedars-Sinai Hospital.
Sure. Thank you so much, Becky. It's really an honor to be here with you. And you didn't ask me to say this, but I have to just say, the Jewish Federation of Los Angeles is an organization that's so close to my heart. The truth is, Cedars-Sinai and the Federation go back many, many decades in Los Angeles, but the Jewish Federation is really the heartbeat of Jewish Los Angeles at all times. But thanks to leaders like you and Jay Sanderson, it's at times of crisis, whether it's fires or anti-Semitism or this entire pandemic, that the Federation really shines and protects and leads our community. And so I just want to express my gratitude to the Jewish Federation of Los Angeles. It's really an honor to work with you on anything, and nonetheless something so important like this. And Dr. Riggs, who you'll all have the fortune of hearing from soon, and I know you have many times already, is such an incredible leader here at Cedars-Sinai. I bother him with texts and emails all the time, and he's so gracious. And since the beginning of the pandemic, we had him on conference calls with rabbis. He's been guiding us and instructing us and teaching us, and tirelessly, really. And it's really a privilege to be here with him and to learn from him. I just want to open up with a few words about vaccination in Jewish history, in Jewish thought, just a couple of really important background ideas before we get deeper into the science and the discussion tonight about what's happening now. The Jewish community's interaction with vaccines goes all the way back to the beginning. Dr. Edward Jenner, when he created the first vaccine against smallpox, the rabbis wrote about it. The people were asking the rabbis, should we take the vaccine? It's published in the books at that time, the Tiferet Yisrael. That's Rabbi Yisrael Lifshitz. It was one of the important commentaries on numerous important Jewish works, the Mishnah. He wrote at the very beginning, he said, I believe that it is, first of all, he said, Dr. Jenner is mi chasidei umot ha'olam, one of the righteous people of the world for inventing this vaccine, he wrote. And he said he felt that all Jews who were concerned should take the vaccine. He said, and at that time, it was much more dangerous. It wasn't like vaccines of today. He said, even though some people die from these ancient vaccines, you should still take it because the risk of the vaccine is lower than the risk of the disease. And that was back then when vaccines were nowhere near what they are today. The other rabbis of the generation also wrote in favor of the vaccine, even going back then. What many of the rabbis wrote was, we're obligated by Jewish law to listen to doctors. And even if there's difference of opinion amongst doctors, we have to listen to the majority and to what the government authorities are telling us. And they felt, we're being told that this is what we should do by the doctors, and therefore it's important to follow the majority of doctors. And they based it on a fascinating teaching from the Torah, an ancient teaching that many people might not realize is so relevant today. The Torah tells us in the book of Deuteronomy that on our roofs, especially remember in ancient times, they had like Pueblo type of, flat roofs that people would sometimes walk on the roof of their homes. And the Torah says you have to put a guardrail on your roof. It's a requirement because it's dangerous to walk on a roof without a guardrail. But the way the Talmud and then Maimonides and then the Code of Jewish Law, the Shulchan Aruch, all codified this was they said it's not just a rule, a verse about guardrails on roofs. It means we have to be proactively doing everything we can to prevent illness. We have to be doing whatever we can to be responsible, to be careful, to avoid danger. And so the example the Torah gave was a guardrail on your roof. But it means anytime we have a danger in front of us, both to ourselves and to others, we can't just say, well, I'm not going to go on my roof because someone else might go up there and it would be my responsibility, therefore, to make sure that my roof is safe. And so the rabbi said there's a Jewish responsibility to society, to ourselves, to our health, based on that fascinating verse. And the rabbis until our generation have argued that this is the part of the source for the requirement for preventative medicine and for vaccines. And that's why even today, in the broadest spectrum, from Reform rabbis, conservative rabbis, modern Orthodox rabbis, ultra-Orthodox rabbis, the Sephardic chief rabbi of Israel, the whole gamut have been endorsing this vaccine and in fact have been vaccinated themselves. Some questions people sometimes ask is, well, I heard there's pig products in the vaccine. So first of all, it's not true. But let's say it was true that there was pig products in a vaccine. Even that wouldn't be reason not to take a vaccine because pig products are forbidden for those who keep kosher to eat them, but not to ingest them in other ways. For example, people use them all the time in hospitals with pig valves, let's say. As long as you're not eating the valve, it's saving one's life. And pig is not one of those objects that the Torah prohibits from getting benefit from, only eating. But even if it was, when it comes to saving a life, of course, one would be allowed to ingest it. Anyways, it doesn't include pig, but this is one of the questions people have been asking. And for these reasons, and because the rabbis have been so supportive, and because, being here in the hospital these past 10 months, we want this pandemic to be over. We've had enough. It's been horrible. The amount of suffering, pain, whether it's physical, emotional suffering and death, or whether it's been the societal pain and suffering, economic, in every category, this pandemic has been horrific and we want it to be over. And our way of getting through this pandemic is through getting vaccinated. And that's why we're encouraging it. And so, and with much gratitude to Cedars-Sinai and to the scientists who worked on this and everyone involved in creating this vaccine, because I've been, supporting COVID patients and staff and going into the rooms this entire time. When Cedars-Sinai got the vaccine and rolled it out to employees on the front lines, after, of course, in the proper order, I was able to receive the vaccine. I've now received both doses of the vaccine. Thank God, I feel great. And I must say it was very emotional receiving the vaccine. It brought me to tears. I said a blessing. I think some people said the Shechianu blessing. I said the Hatova Metiv, blessed is God who is good and does good, because that's the blessing for when one experiences joy for themselves, and it's a joy for other people as well. When I received the second blessing, the second vaccine, I said the prayer that some people say before taking any medicine, just thanking God for this and praying that it will go well, and thank God it's gone very well. And I also feel a sense of, it was a privilege to receive it, and for me, that also obligates me. It obligates all of us to show extra concern for those not as privileged, for our whole society. And so, we want to be role models. And so we're doing it. That's why I got vaccinated. It was mixed emotions, but now there's a light at the end of the tunnel. And that's why we're encouraging everyone. And that's why I know people have very important questions, and we don't belittle those questions. We need to talk about them. And that's why we turn to experts, people really on the front lines of this, such as Dr. Rick Riggs.
And Rabbi Dr. Jason Weiner, what a role model you are, what a dugma you are for our Jewish community. And Dr. Riggs, I know you're going to give a little bit of your Torah. It's very much science-based, and we are all anxious and curious to hear what you have to say about the vaccines.
Great, thank you. Thank you for the invitation to be here with you today and to be able to share some very optimistic progress and exciting news. It's fitting that our vaccination site at Cedars-Sinai is taking place in Harvey Morris Auditorium, where indeed our mural of Jewish history is displayed. And it's fitting, we call it our happy place right now, because there is, in the hospital, because there is so much intensity around the COVID population as we care for them. If we could go ahead and start with the slide deck, I think that it'll be helpful for us to begin to move through that. So I want to talk about the messenger RNA or mRNA vaccine overview and try to provide some insight on this. These slides were prepared by the strategic advisor to meet my office, Christopher Simon, so I want to thank him in advance for that. So if we can go to the next tile, we'll see that I'm going to try to break down how the mRNA works. So this is a graphic that was developed out of University of Texas in the medical branch at Galveston. And so it looks at, so how does an mRNA vaccine work? And where you see the number 1, it says, while other vaccines are dead or weaken virus to prep our immune system, the Pfizer, BioNTech, and as well as the Mrna vaccine are different. The scientists sequenced the genetic material of the SARS-CoV-2 virus and that causes COVID-19, and they created a synthetic copy of this messenger RNA, also known as mRNA. So, but what is in mRNA? Well, don't think of mRNA as a recipe, but rather think of mRNA as a recipe, but rather than cookies or cake. It tells your cells what proteins to make. So it's a recipe for proteins. So what it does is, since there's no live virus or virus at all in the Pfizer, BioNTech, or Mrna virus, it's just the mRNA, lipids, a fat or oil particle, and salts and sugar. When it's injected into your arm, the mRNA gets picked up by our cells. And what we see on the next tile is that the body, once it's absorbed, it begins to read this and starts making the protein spikes like the ones on the outside of the coronavirus after it's been read. And so the mRNA is then dissolved, and the spike protein cannot make you sick, but you will act as a target for your immune system, and your body will build antibodies that can fight the real virus if you're ever infected. So both the Pfizer and BioNTech and Mrna vaccines require 2 shots for your body to build up its full immunity. We think in part that this is partly because the first one primes it to say, oh, this looks new and different. And that's why folks develop a little bit of symptomatology in the local injection site. And then the second time, 3 or 4 weeks later, the body mounts a sustained immune response. And that builds up full immunity. We'll need about 75 to 80% of Americans to get vaccinated to finally stamp out COVID-19. So when it's available, I encourage everyone to get their vaccine. The other thing that you may have heard of in the news is that indeed, the virus is mutating, and I'm going to come back to that in just a minute. Well, are mRNA vaccines new? No, they've been used for years. And on the next slide, you'll see that the number of vaccine trials that have occurred over time have included things like cytomegalovirus, Zika, rabies, and influenza. And so all of these trials have been around for years, some of them since the early teens in the 2000s. So this is not a new technology tested in humans for the first time. And this doesn't include the number of cancer vaccines and therapeutics approach based on mRNA, where we actually train certain cells to attack certain cell lines based upon the oncologic features of that particular cancer. So on the next slide, we'll talk about sort of the production of this. How did scientists do this? And why is this different than other vaccines that have taken years? Well, several factors made it possible for the vaccine to be developed quickly and without compromising safety. The platform or mRNA technology is not new, been studied for many years, as I spoke about the Ebola, Zika, and the flu. Some of the platforms actually were already in production for influenza, and they actually just switched out the virus to understand how that might work. Government and private funders gave unprecedented levels of financial support to expedite both vaccine development as well as production. Usually those are in a sort of a stepwise fashion. You do the testing and then you do the production. As soon as they had a viable vaccine to begin to move to the next phase of the trials, they also began production. So it was a parallel process. And clinical trials received a much larger number of volunteers than is typical in the early stages. People jumped in, people volunteered, they raised their hands, and they said, how can we help? And so that sped to the sort of development. The ingredients are simple, as discussed earlier, and so that there shouldn't be any concern about those particular pieces. There has been some concern if you've previously developed anaphylaxis in certain cases, but again, one should consult with their physician with regard to that very specific piece. Well, how are we doing with mRNA vaccine distribution and administration? The next slide shows a state.
Questions that everybody's waiting to hear, right?
Yes, a map of the United States. And so again, we're looking at sort of California. We've had about 1,800,000 doses, and so delivered, and people initiating vaccine. We've done just about a quarter of those, and so understanding how we can speed up that process is part of our job. And as you have heard, there's a loosening of the criteria. Folks wanted to make sure that the most vulnerable in long-term residential facilities and the caregivers there, as well as healthcare workers, receive the vaccine initially in order to continue to care for our patients. The importance of getting everybody vaccinated as quickly as possible is to decrease the amount of variants that may occur and mutations that may occur, so that we're not looking at this as like a flu, vaccine which has to be redeveloped with different variants every year. The spike protein is unique to this particular virus, and we believe that the multimodal antibody response will indeed be quite valuable and sustained. We do not know the length of that immunity at this point because, again, the vaccinations have been around now. It would be a total of about 8 months total from the start of the trial. So we haven't had the ability to study those particular pieces. And so what does vaccination look like? The next slide shows indeed our happy place in our organization with folks getting their vaccines. These are actually physicians and healthcare workers that volunteered, and their comments about why they felt it was important to get the vaccine. And what I can say is, if you ask folks, the most common side effect is, initially is a little poke in the arm, a little arm soreness, followed by a state of euphoria, because it's really a light and a gift, as has been noted. So lastly, can you change your behavior after you get vaccinated? Not now. Even once an individual is vaccinated, it's critical to continue masking. Why is that? Well, because if I'm vaccinated and I'm exposed to the COVID-19 virus, I may get the virus and I may harbor it. My body may fight it off and I may not really feel anything, but while I'm fighting it off, I can shed to other people who may become infected. So until we reach herd immunity, which is very far down the line, it's mask for all. My mask protects you and your mask protects me. And we all need to sort of understand that is a sort of a respect for one another that we can all live up to and carry on. And it's a small item, a small action that we all can take, and we all indeed should benefit from that as we move through the rest of the COVID-19 pandemic. And with that, I think I'll close and open it up back to Becky for questions.
Yes, and I am, for everybody out there, I am taking questions that we received before today, as well as trying to go through some of the questions that are coming in right now. I just want to go back to a little bit of the role modeling piece. And as we think about vaccinations, just thinking about our responsibility for one another and how so many of us are taking monumental steps to help each other. So Rabbi Weiner, maybe you can tell us a little bit about the role you have played and your fellow chaplains have played in the hospital during this pandemic. And maybe there's a story you can even share with us. Without attribution, of course.
Yeah, when I think about responsibility throughout this pandemic, I've been thinking about the role model of Esther in the book of Esther and the way she, risked her life on behalf of the community to try to protect people, and the way that she stepped up, and there's a need for responsibility. The chaplains, everyone in the hospital. It's been an inspiring time to be here, as much as it's been a scary and difficult time, to see the way people step up and don't run away from danger, don't run away from problems, but say, we're here to help. We have responsibility to help. We have the tools to help, and we want to help. And we've tried to come up with creative ways of doing that. Like, so for example, patients are alone, they're isolated. It's very difficult to be so alone. And we recognize that that's difficult. So that's why, as chaplains, we're going into their rooms, trying to be with them in a safe way. We have found that in addition to connecting people with their family, let's say through FaceTime, sometimes using creative methodologies of entertaining them or supporting them. So we partnered with some musicians, for example, who are concert musicians, but who have been basically out of work since the pandemic. They don't have any concerts. So they volunteered to do on-the-spot concerts when patients request them. And so patients can request a song and have a musician play that song for them live while they're in their bed. And they feel so supported and appreciative, and it's really beautiful. We've, the hospital, as you know, Cedars-Sinai is a welcoming, open place. There's lots of ways to get into the building, but for the past 10 months, there's like 3 entrances because everyone has to be screened. And so as much as that's more challenging, it's also an opportunity for chaplains to be there to, be there to support staff, to see them as they come in, to thank them as they leave, to offer blessings if they want them, to offer treats or goodies, or just be there to be supportive. So it's been a time of trying to find creative ways of being helpful in a very, very dark time.
So beautiful. We have had multiple questions both before today as well as the questions that are coming in around a particular population, pregnancies. Dr. Riggs, maybe you can talk to that. Safety, some concerns, and perhaps some observations.
Right. So one of the photographs was actually of a dermatologist that is currently pregnant and was getting the vaccine and publicizing her receiving it. Pregnancy is a higher risk group for complications in COVID-19. Therefore, obviously, the study enrolled people who may have been pregnant and who may have become pregnant, but they did not enroll them in a specific group in a large enough number to study the effects on pregnancy. But given that it is a higher risk group for complications with COVID-19, we are recommending that our healthcare, sort of the CDC and others are recommending that that folks do get vaccinated. Again, you are left with antibodies, no live virus. So even if you're breastfeeding or that type of arrangement, there would not be any risk to the newborn in that particular setting. So it is highly recommended for folks that are pregnant. There is, that's one of the myths that's been going around, is that there's limitations on this, that, or the other. Just look for the facts. The facts are that there's very few limitations for this vaccine. Active infection with COVID or some other type of acute medical condition is probably not recommended to get vaccinated at that time, but that would be with any vaccine. One would not want to challenge your immune system when one is fighting off something that's in your own body already.
All right, so let's move to another population. So much of the work that the Federation certainly does is with children, with schools. So what's the impact that these vaccines are going to have on schools when we have teachers who hopefully will be vaccinated, students who are not, and any word that you might have on when educators will be approved for vaccination, and that will be a separate group, a separate entity that will be kind of put on a priority list.
So I'll start. It'll take years probably for us to understand how we can get all the way down into the sort of newborn and or very early in life population. What has been successful for schools has been testing and tracing. We've seen that over and over again in our sort of multiple different universities and educational settings. And that I think ultimately will be the approach with vaccination of the adults that are in the area, and testing and tracing, contact tracing for the younger folks. And to that end, the X Prize right now is being stood up to develop a saliva-based test that can be run for the cost of a latte in order to help meet that challenge, because the tests now are obviously in the $100 range, and that's not scalable. So there is science and developments that are even going in parallel now that hopefully will land in a place that we can actually think about what school looks like next fall, and understand what that looks like, at least for our kindergarten, elementary, etc. Folks, we may have vaccination ability in the 12 to 16 range later this year, but 16 and above can receive it now.
Helpful, extremely helpful as we think about the next academic year. So listen, we know you at Cedars-Sinai Medical Center are following all the rules and protocols, but certainly there have been many questions that have come in on this chat about when will I get, when will my parent get? And so maybe you can tell us a little bit of thinking about Cedars-Sinai Medical Center, how you are informed by the county, by the state, of how this whole rollout mystery for many of us is working.
Right. So, as you might have heard, the federal sort of authorities in this particular instance with the whole COVID-19 have delegated much of the responsibility to the states and to the local county health departments. And indeed, certain states have decided to approach this in different ways. You may have seen the lawn chairs in Florida or in Texas, people lining up. That I would encourage everybody to go to the LA County Department of Public Health website and look at the vaccination site. It has a very easy when can I get vaccinated button there. That's very easy to understand where you might be vaccinated. We expect it's currently open to all healthcare workers and some essential workers currently for us to vaccinate. We have not been given the green light to open it up to patients and patients in high risk categories. So I suspect that that will come in the next week to 2 weeks. And when that does occur, I would encourage folks to understand that we have been in this pandemic for 12 months. So waiting another 2 or 4 days, 2 or 4 weeks is not going to change your behavior, and it's going to allow an orderly, sort of allocation and distribution. Indeed, you're going to be seeing, I think you probably have seen that the Dodger Stadium is going to be turned into a mass vaccination site. We will be standing up something for our community at Cedars-Sinai, but I would also encourage folks that there will be smaller pods that will also be available, and many may pop up at your local, pharmacy, as there are going to be doses that are distributed there also. So I would encourage you to continue to watch and look for communication. But in California, we have not been given the go-ahead for patients at this particular time, unless they are in the hospital and we're discharging them back to skilled nursing facilities.
Thank you for giving us the information about what Cedars is planning on doing, because we have lots of questions coming from people who are serviced by the medical center and curious. So hopefully that was helpful to some of you. I'm going to shift the conversation a little bit. So many questions coming in, so many questions that were received before. The two of you are constantly caring for others, answering other people's questions. How are you two doing?
Well, I mean, it has been an exhausting year. It's been an exhilarating year. I mean, speaking for the people that I'm encountering here on the staff at Cedars-Sinai, is people who signed up to help. They want to help, but they're human, so it is not easy. That's why we are really encouraging people. We're trying to care for people, trying to care for ourselves. We encourage people to recognize what things they do in their lives nourish them the most, and to make sure that they are continuing to do those things. For me, it's, exercise, music, recognizing when you need a break, when you need to stop. It's just been nonstop this past year and exhausting, but like I said, it's what we signed up for. And I've just been so impressed by Cedars-Sinai and the caregivers here, the way the dedication and the commitment to caring for people in need.
So thank you. Yes, we are buoyed by the community support. We've received tons and tons of food donations, especially initially when the restaurants were sort of shut down. We continue to receive letters from schools and communities and and folks and donations. The COVID-19 might actually stand for the 19 pounds we're going to gain from all the food that has been delivered and us being, sort of having to create different lifestyles. However, what I would say for myself is that connecting and sharing with others in the same conditions, in the same situations. This is really serious. And, we, from the standpoint of it's hard work, there's a lot of aspects that go behind all of the planning and sort of stretching to try to take care of as many folks as we're taking care of. And connecting with others that are doing the same creates a human emotion, just like much of that does when we're connecting around religious or holidays. creating the emotional connection with others is very meaningful to have, your needs met and someone who can understand your needs. And, as Dr. Weiner stated, it's really difficult to round upstairs some days because, there's just a lot of really intense care going on. But we appreciate all your support and prayers, and also support from all the good wishes that we hear. And so thank you for all of that.
And before we started this webinar, Dr. Riggs commented that, he's probably not going to get to process all this until this is all over.
Sounds like we may have lost Becky.
I think we just lost Becky. I guess maybe while we wait for her to come back, if there's any information, Dr. Riggs, that we haven't shared yet about different populations or about kind of the vaccine and the effectiveness that you might want to share while we figure out how to get her back on.
Sure, happy to do that. So there's in the chat, there's some questions around when do you actually develop immunity? And so the immunity at 12 days with the Pfizer product is about 52%, meaning that we know that there's some immunity after the first dose, but that increases to 95% 7 days after the second dose. And so there are also comments in the chat around, sort of, is 95% good enough? Yes, we don't nearly get that with many of our our other viral vaccines. So we do think that that's really significant. And then the other pieces, again, I think I addressed earlier about how long immunity will last. We don't know that. We'll be able to give you rolling timetables of that as we have a longer history with the vaccine that's been deployed already.
There's a lot of questions I noticed people have been asking about, like, if it's true about, a need to utilize vaccine at the end of the day because they go to waste. I see people are asking about that. A lot of people are always asking me, do you want to clear up, Dr. Riggs, about how that works?
Yes, so we're planners at Cedars-Sinai. So we haven't had the issue of having doses that would be gone to waste and calling in or having signups for those. Because we have such a large employee population, if we see that we'll have 6 or 8 or 10 or 15 doses, we put a call upstairs to the units, and the send folks down that haven't been vaccinated. We're still working our way through our 20,000 healthcare workers, and to date, we vaccinated over 10,000 and are moving through that as quickly as possible. And we've begun also giving our second doses of the Pfizer vaccine. So again, I think that there are smaller sites that have had that sort of wastage issue. We haven't needed to do that because we've got such a large population on campus at any one time, and also are planning the sort of end-to-end workflows around that.
I'm back. Sorry about that.
All right.
The computer crashed, the phone wouldn't come back on. So I had an important question to ask. As you guys were talking about responsibility to community, several people have asked, can I donate blood? Because they want to help others. So how safe is it? Tell us what it's all about.
So yes to donating blood. We definitely, many of the places where we used to collect blood, like schools, like college campuses and such, or large events have been shut down. Blood drives have been shut down. So we do desperately welcome the sort of donation of blood on an ongoing basis. You are safer here on our campus than you are in the grocery store, because everybody here is in PPE and is tested and screened before they come on campus. And so I would, yes, we welcome that. That would be a great way to be able to contribute. now and on an ongoing basis, because, again, many of the places where we would have these blood drives has been limited over time.
Thank you. Thank you. Share a little bit more just about safety issues and elderly parents and any other things that you want us to know about.
So I think, the safety of the vaccine has been widely publicized. Very, very small, like 22 out of 1.8 million doses. Folks had something that was serious enough to have medical intervention, such as, the anaphylaxis. So that's a very, very small dose. So it appears extremely safe. I'm not quite sure with regard to the sort of elderly parent question, but what we do know is that age is a predictor of increased mortality and morbidity with this particular virus. And so we've been tracking that in and around our patient populations, which is why the original CDC guidance was for those over 75 to be considered in the first patient cohort. Indeed, we have some special populations at Cedars, for instance, maybe our transplant patients or whatever, that have also have been recommended for first swath of patient consideration. We will be following whatever guidelines LA County Department of Public Health puts out. And as you can imagine, and I'll continue to say this, we want to get as many shots in arms as we can. And we have 900 patients to care for on a daily basis, many of them with intense special needs. So we are looking to do our part, and we're also looking for as many folks in the community, other vaccinators, for instance, to do their part too. So we're hoping to team up with lots of other hospitals who will become stand-up pods to help with that, as well as the retail pharmacies.
So talk to us a little bit about one arm, two arm with your shots. First shot, second shot goes in one arm. The second one should go in a different arm. And just in general, the whole theory behind divvying out these shots in a first time basis and a second time basis.
So the body's going to absorb it no matter which arm it's put in. So it does not matter. It's not the local site may get a little sore because it's reacting, but it doesn't matter if it goes in one arm or the other necessarily. I do want to point out for everyone that as soon as you get your vaccine card, to please take a picture of it, because that card, the first card, will have your date and the type of vaccine that you got on it. And so when you go back, they'll want to make sure it's an appropriate time frame, but also the same vaccine. So take a picture of your card. I'm sure Rabbi has his filled out. And there we go, see? So take a picture of it so that you have it with you at all times also, because that will also be necessary to help process the sort of second vaccine. And then with regard to allocation, I do think that it's going to be dependent upon the sort of multiple vaccines coming out on the market. So we could actually be in a situation in, say, March or early April, where we have 2 or 3 more vaccines on the market. And with those flooding the market, it really will be a logistical challenge for us to get as high vaccination throughput as we can. Much of the documentation on the back end is to make sure that vaccines are not being diverted. As you can imagine, there's a high degree of demand, and we have had people already offer significant sums of money to jump the line. That's not who we are. We serve our community, and we serve them equitably. And so we will be following all of the appropriate rules, as well as sort of keeping an eye on how we can serve our community in the most sort of judicious way as we have the history of doing so.
Rabbi Weiner, you may want to talk about that judicial piece a little bit, and our responsibility to follow those rules and regulations and be responsible to each other.
Yeah, I mean, Jewish law since the Talmud actually has triage and distribution of scarce resources, rules and parameters. And most of the rabbis today say, since we see that there are such rules, even though it's difficult to sometimes apply them specifically, they say, well, you see from that there is such a thing as following, government guidelines in terms of triage and distribution, and therefore we should be following what the government determines. The idea of rationing and using things in the appropriate manner and not just kind of having everyone stampede or give out to the highest bidder, but to the highest need. And on a population health basis, primarily, is what Jewish law says, which is what is happening in America. And what's the best way to help the most people, to reduce the most risk, and to spread the vaccination to the entire community. A lot of it, when you talk about responsibility, the Talmud gives an example of 3 people sitting on a boat, and they're in the middle of the ocean, and one person in the boat starts drilling a hole underneath his seat, and the other people say, "What are you doing? What's going on?" He says, "No, don't worry, I'm just drilling the hole under my seat." And they say, we'll all drown together. So, we have to be concerned about the entire community and not just kind of our own concerns and, what's the most responsible public health way of taking care of things.
How many vaccines are out there? Freezer capacity other than at Cedars-Sinai Hospital? Because we are anxious. We are anxious for it to as quickly as possible.
Right. So with regard to the freezer piece, I can tackle that one first. They chose large institutions because we had the freezer capacity for the ultra cold chain requirements. So that's the Pfizer vaccine. The Mrna vaccine that's also out now is primarily going to smaller sites and can be refrigerated for quite a period of time. It doesn't require the exquisite cold chain handling. We probably will be in receipt of both of those vaccines, sort of to scale on our campus and then at other different sites that are more remote for Cedars-Sinai, like our Marina Del Rey campus. There was also a question in the chat around, if it's so crowded at Cedars, then how won't I be at risk? We're looking at standing up not sort of on our campus, sort of on our campus grounds, but not on our hospital footprint, in order to facilitate standing up anything that we would do for community. And indeed, probably will be based upon a drive-through. One should note that you have to be monitored for somewhere between 15 and 30 minutes afterwards. So you can see that if you're vaccinating 100 folks an hour, that you actually need parking for up to 400 folks as they stream through and peel. So and again, those monitoring pieces are important. And then of course the proximity for treatment. If there is something that does happen, we have to prepare for that too. So know that we are, as I said before, we're planners. So we are trying to map out all of those particular pieces in the safest way possible. And I want to just reiterate that we are a very safe campus. And by the way, your doctor's offices are very safe. We do not want people to delay or needed care, because we don't actually want that condition to progress, whether that's diabetes or congestive heart failure or other skin infections. You need to get treatment for those things now, so you don't wind up in the hospital. We are in the midst of a surge. We're almost 3 weeks past our post-holiday sort of time frame, and that's when we saw the post-Thanksgiving really tremendous spike up in our hospitalizations. And so we want to be available for our community, but that means doing everyone's part to take care of chronic medical conditions on an ongoing basis. Doctors' offices, again, are some of the safest places you can actually be right now. And so, I wouldn't worry about that particular aspect of, of delaying care because of fear of being out and exposed to COVID in a doctor's office.
All right, so my last questions for both of you is to dream a little bit. And if you had the crystal ball, what will the fall look like? For so many of us in the Jewish community, it is the time that we do gather. So dream a little, think forward, give us a sense of what the world might look like.
I think you should coordinate your outfits with your mask because I don't think
Okay.
we're going to be at 70 or 85% of the population being vaccinated by that time. We have to be really careful and respectful that we want to move this pandemic, from a code red down to something cool blue. But if we just don't know enough about how this may all play out. So I'm hopeful that we'll be have less community transmission, and that'll mean that we'll be allowed to gather more freely, but we will have restrictions. That's my crystal ball. I hate to be like pessimistic, but I think it's realistic to say that we're going to be in this for 2021. We just have to be patient and know that doing it right is better than just trying to do it.
Rabbi, why do you want to add something? Certainly the high holidays, I'm sure, are on your mind.
Yeah,
You
definitely. I
serve
mean,
a congregation as well as serving Cedars-Sinai Hospital.
right. I would say it this way. First of all, looking back at last year's high holidays, the creativity and the dedication that the Jewish community, rallied around to find ways for each community that would work, mostly online or in backyards or in tents or tiny, whatever people came up with to be safe and do things differently very quickly. It was very impressive to see how people have found ways to adjust. And I'll just put it this way: I'm hopeful and very hopeful that at least this year's high holidays will be better than last year's. There will at least be healthier. There will be less death. There will be less fear. We will still have to be careful. And I definitely will be asking Dr. Riggs, and he'll be expecting many more texts from me at all hours of the day. But and so we'll have to be cautious. And okay, if we're gonna have to match our masks to our tallis or to our outfits for shul, but I think it's hopefully at least a better place than we were last year, and may it just continue to improve better and better, and I'll be happy with that.
And again, we thank you for what you are doing for our community. This webinar will be posted on the Federation website, as well as tomorrow. Everybody that registered for this seminar will get a FAQ sheet produced by Cedars-Sinai, so we can all together as a community continue to educate, to continue to be vigilant, and continue to that time when those masks can come off, when it's right, when it's appropriate, and be together again. And with that, I thank you. I thank everyone for all the questions and all the information that was imparted. We tried to get to as many of the questions as we possibly could. On behalf of the Federation, we thank you, and we wish you a good evening and a safe evening.